Just on that story, the latest we're hearing tonight is that the death toll in Gaza has now risen to around 3,000 people. Many of them are believed to have been civilians killed by Israeli airstrikes. About 1,400 people have been killed in Israel when the Palestinian armed group Hamas launched that surprise attack over a week ago. And the Israelis and their Western allies believe that the action they've now launched is justified as they set out to eliminate Hamas, they say. But concerns about the humanitarian situation persist, as you were just hearing from the United Nations. Let's get the view now from Doctors Without Borders, South Africa spokesperson Monica Genya. A very good evening to you, Monica. What are you hearing from your teams about the situation in Gaza now, more than a week since the bombardment began?
Yes, the situation is catastrophic, and we are facing a situation where hundreds of thousands of people are going without drinking water, without food, with scarcity in fuel, in electricity, facing a huge risk of increased humanitarian crisis, a huge risk of death. And
there's concern at the moment that there's going to be a full-on offensive launched by the Israelis. We know that last week Israel said, well, it was ordering people in Gaza to evacuate and move further south. People have also moved towards the direction of the Rafah border with Egypt. But we're hearing that even in those areas, there's been bombardment there, sparking further concern for the safety of civilians who have no affiliation to Hamas. How concerning is that for you as a medical organization?
It's extremely concerning. Humanitarian conditions are not in place for the evacuation or the relocation of over 1 million people to southern Gaza from their homes, from their shelters. Many are sleeping in rough conditions. Access to drinking water, like we said, is dangerously scarce. There's no electricity, very poor hygiene conditions, and this is fertile ground for the development of more health issues over the next few days and weeks.
So where is it safe to be in Gaza at the moment? Because the Israelis last week, when they faced criticism, said, well, they're doing their best to warn people before they target what they say are Hamas hideouts. We've seen leaflets, for example, warning people to evacuate, being airdropped in some parts of Gaza, especially in the north on Friday. But where can people go? As you're saying, moving 1.1 million people further south is near impossible.
At the moment, our teams tell us there are no safe spaces. There are no safe spaces at the moment where people are being relocated to. As you said, we are experiencing bombardment night after night. It is not safe anywhere. MSF has been calling for a humanitarian corridor, some safe space that people can go to seek medical care. Medical facilities and personnel must be protected and respected. Hospitals and ambulances are not targets. There are no safe spaces at the moment.
And where does that leave the ability of an organization such as Doctors Without Borders to operate? If it is unsafe, as you're saying, and there is still, as a result of the total siege, a blockade on essentials such as fuel, we're hearing in some hospitals, for instance, even painkillers are now unavailable.
Absolutely. We've been left in a situation where our medical personnel are watching helplessly as patients are screaming in pain for lack of painkillers and other medical supplies. We've been asking for the border crossing at Rafah into Egypt to be open so that we can get medical supplies into the area and replacement humanitarian workers. We have around 300 colleagues working in Palestine, international staff and local staff. Some of whom are trapped, some of whom we cannot get in touch with, and we just need to have a humanitarian corridor that is in place so that we can get to our patients.
It's one thing for people to be killed or injured in the bombardment, Monica, but the blockade, for example, on the movement of supplies, including medicine, but the issue of food, fuel and water, which was cut off in some areas. Israel has said that the flow of water has been restored, but the Palestinians in Gaza say, well, that's little to nothing if there's no electricity to pump said water. What are the health risks that come from a situation where Gaza is densely populated, people are largely displaced in some areas, injured, have insufficient water, insufficient food to eat? What may be the longer term, in fact, ramifications of that?
Well, we're urgently calling for the restoration of sufficient and immediate access to at least drinking water. We're talking about a matter of days before we see deaths occurring from this. Our teams report that we do not have sufficient access to drinking water, even for healthcare personnel. So nobody has access at the moment. And then, of course, food, fuel, electricity. Our primary healthcare centers are closed. They're not operational. Chronic patients are going to suffer. Medication stock is draining, even in private pharmacies. The situation is impossible at the moment, and healthcare workers are standing by helplessly, witnessing all the suffering that they're not able to intervene in.
There was from yesterday the expectation that there'd be a corridor opened when people with dual citizenship, Palestinians, for example, who may have 2 passports, would be allowed to cross into Egypt through the Rafah crossing, and other foreign nationals who may be trapped in the enclave to do the same. On the other side, from Egypt, there was a long queue of trucks that were meant to carry aid into Gaza. Do you, as MSF, have aid that is now ready and waiting to get in, especially along that corridor?
Absolutely. Close to the Rafah crossing. If this was made possible, then we would be able to get our trucks in, our medical supplies in. So far, our teams are not reporting that this is possible at all. So we are ready and waiting, ready to intervene, but we do not have access as of yet.
Monica Genya, Doctors Without Borders, South Africa spokesperson. Good to speak to you. Thank you.